Continuing my discussion on anxiety disorders, I would like to discuss depersonalization disorder and mention that for additional strategies to help cope with stress, anxiety, depression, and relationship concerns, please take a look at my book, Life in the Past Lane, Learning How to Focus Forward, available on Amazon as an audiobook, ebook, and paperback. The feeling of depersonalization happens at some point in the lives of most people. It's what you might feel when witnessing a horrible car accident or when receiving devastating news. The sensation of not being connected to your body or reality for a moment is a defense mechanism of the brain to reduce the amount of emotional trauma experienced in a moment. When something horrible happens, it may feel as though you are in a dream or watching the event happen from outside of your body. When this feeling occurs on a regular basis uncontrollably, there is a possibility that there is a form of dissociative disorder present, such as depersonalization disorder. Depersonalization can be a protective mechanism, but having the disorder can have life-altering consequences. This disorder occurs most commonly from the teen years and into middle adulthood. It is usually not diagnosed in the very young or very old. It is more prominent in those who have witnessed or sustained some form of trauma. Those who have continued trauma, abuse, dysfunction are at higher risk of depersonalization disorder than those in healthier environments. But a history of trauma is not required for development of the disorder. Depersonalization disorder might be mistaken for being flighty or absent-minded. A person with this disorder will be aware that they have lost a connection with reality, emotions, or both. In some cases, the sufferer will become so disconnected from themselves that their body feels numb, body parts might look as though they are distorted, and they may feel a sensation of floating above themselves. An emotional disconnection from others is also a sign that depersonalization disorder might be an issue. It is difficult for an outside observer to determine that someone has this disorder simply by observing or interacting with them. Their behavior might seem peculiar or strange, but there are no specific behaviors that would lead an acquaintance to suspect depersonalization disorder. A person with this disorder will describe feeling as though they are in a dream or that their body or speech is not in their control. They may feel robotic or plastic with little sensation for short or extended periods of time. The symptoms of the disorder are obvious to the sufferer and do not create memory loss. Although the feeling of being outside of oneself is strong, the person with the disorder does not retreat into a mental state in which they are unaware of their surroundings. Their lack of awareness would be like someone who is daydreaming or momentarily distracted. The symptoms of depersonalization disorder have differing levels of severity. Some people choose not to seek counseling and just cope with the episodes, while some feel disconnected that they require mental health counseling to live a productive life. Treatment for depersonalization disorder includes psychotherapy and sometimes medication. There is no medical treatment for the disorder specifically, but there are often other disorders that might contribute to the condition. Without some form of intervention, someone with a mild case of depersonalization disorder could quickly become more severe, leading to loss of friendship, employment, or difficulty in school. In counseling, the mental health professional will help the client reconnect with reality. By doing reality testing, the person with the disorder can begin to consciously make the effort to engage more with reality and not allow disconnecting to happen. By learning relaxation techniques and communication skills, it is often possible for all symptoms to go into remission. The disorder is very treatable for those who are willing to participate in counseling. For additional discussions and strategies related to stress, anxiety, depression, and relationship concerns, please take a look at my book, Life in the Past Lane, Learning How to Focus Forward, available on Amazon as an audiobook, ebook, and paperback.